I'm James, and this is Petra. We're co-founders of Breaz, and we're developing a medical device to detect and monitor chronic respiratory diseases. We want it to be as easy or easier than measuring blood pressure at a doctor's, pharmacist's, or even at home. This year, we've all been aware of how COVID-19 has affected our lives. But apart from acute diseases like corona, there are chronic breathing diseases which affect 1 billion people and actually kill more people than COVID every single year. But to many, these diseases remain invisible. To tackle this problem, we've put together a team of scientists and engineers from world-leading institutions. We have Petra from Max Planck, Eduardo from the Politecnico di Milano, myself, James, from Cambridge. We've also partnered with leading respiratory experts and hospitals to make sure we're creating a clinically useful solution. This is me in a hospital in Barcelona, where we were searching for unmet clinical needs in the respiratory department. I was shocked to see how people suffering from breathing diseases like COPD cope every day. They require frequent hospitalizations, oxygen therapy, and they have a constant struggle to breathe. Early detection and monitoring of this disease is crucial to prevent this sad outcome. In the hospital, in the lung function lab, I saw how this testing is currently done. It revolves around a test called spirometry. Now, this test hasn't actually changed much since the 19th century and goes a little something like this.
Go, 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 go.
It's exhausting to do, and hard to get a good result, even when you have a nurse yelling at you. The test has to be repeated and repeated, and even then, it's hard. In rural settings or in primary care, where there's limited resources, this leads to a huge misdiagnosis of the disease. Our solution is a hardware tool which is both sensitive and accurate and is suitable for the screening, diagnosis, and monitoring of chronic respiratory diseases. All the patient has to do is breathe normally into the device.
That's it.
It's comfortable and easy to perform, and can be used by a specialist as well as a non-specialist. And importantly, it gives comprehensive and intuitive results. This allows us to reduce this misdiagnosis. We're not trying to reinvent the wheel here, and we're basing our technology on an existing clinically validated technology. To that technology, we add new sensors and are reinterpreting it using machine learning, trained by lung specialists.
Whereas our competitors are focused on the specialized sector, assessing individual properties of lung health, we provide a simple and holistic assessment that can be used in any environment. It's like having a lung expert right next to you. Our solution will be accessible through a subscription-based model. We also offer a premium platform for those patients that need regular testing and follow-up. The subscription model reduces the barrier to market entry in primary care, something our competitors suffer from. This allows us to reach both outpatient and hospital sector. Our first market will be in Spain, which offers a centralized healthcare system and already has a strong focus on COPD prevention. By creating trust and medical awareness, we aim to enter clinical guidelines, which is led by one of our mentors. Our solution saves valuable time to healthcare providers and long-term cost savings to insurers. Every case diagnosed early on will save more than 30,000 euros over a patient's lifetime. Our journey started 2 years ago. We've participated in prestigious incubators and been awarded international prizes. We also have applied successfully for public funding and been awarded more than 200,000 euros to push our product development. We are currently developing our functional demonstrator, which will be ready by the beginning of next year to collect big data in our partner hospital in Barcelona. After the successful clinical trials, we will be on the market in 2024. We are currently looking for private investors to support our public funding and also clinical experts interested in validating our concept.
Our solution started in a hospital from a real clinical need.
Now we are shining light on respiratory diagnostics. We're making lung testing at Breaz.